Today, we have with us three spectacular reporting fellows from our Campus Consortium Reporting Fellow Program. And I'm going to go through them alphabetically. Emma Evans is a graduate at Northwestern University's Medill School of Journalism. Her reporting focuses on institutional injustices present in the criminal system, housing, transportation, and higher education. Her Pulitzer Center supported project, The War After War, explores the South Sudanese youth navigating questions about generational trauma and healing in a culture that can stigmatize mental health. Diana Reyes is a PhD student at Johns Hopkins Bloomberg School of Public Health in the Department of International Health. Her research focuses on the impact of conflict and displacement on refugee mental health and integration in host country contexts, and particularly in high-income settings. Her Pulitzer Center supported project, Ukrainian Refugees in Turkey, Displacement Impact on Mental Health, highlights the mental health and psychosocial needs of recently displaced Ukrainians who are in transit to Turkey. Blessed Sharif is a fourth-year medical student at the Warren Alpert Medical School at Brown University and a graduate from Johns Hopkins University Bloomberg School of Public Health. Her work investigates how open conversations about mental health are transforming patient lives around the world. Her Pulitzer Center supported project, Mind Over Matter, Inside the Movement to Transform Mental Health in Sierra Leone, documents the first class of psychiatry residents trained in Sierra Leone. Well, thank you all for joining us. My initial questions, I hope, will just be an opportunity for you to talk some about your projects, perhaps from a specific angle. And I want to start with you, Emma, because we have a clip actually from your documentary. Your project specifies, a couple key generational traumas. There's the conflict, and then there's the move to America. And so I'm going to show the clip, and then afterwards, I want you to tell us a little bit more about how you came to your project. And I'm gonna run the clip now. If there's any audio troubles, do let me know.
I learned about depression in middle school. I think my friend had depression, but I was just like, yeah, whatever. She's faking it. Like, depression can't be real. Like, there's no reason to be sad. And then I had a situation where, I had to basically go through high school by myself. I didn't have the support that I needed. And I was really sad. I was depressed. I had to come to terms with mental health affecting my life, and also the shame around it. I felt deeply ashamed about, I'm so tired, I don't want to do anything, and just you're hearing these words you're lazy, internalizing those. It was a really rough time for me. Bipolar 1 disorder, that's actually a brain chemical, there's something going on in my brain that needs to be helped. But for a lot of people, depression, that's because you don't have the support, the material support, food, shelter, you don't know if you can get kicked out of your house, you don't know, you can't even think about next week because you're so invested in what's happening now, how can I go make it to work, or how can I do this and this and this? And that's all societal.
Thanks for sharing that, Ethan, and thanks for having me. I'm so excited to be here. So my project, The War After the War, talks about mental health among South Sudanese youth in America. So yeah, like you mentioned, it goes through a lot of generational traumas, kind of explaining the war, the generational war in Sudan that's been going on for decades, and then the move to America that many of our parents made, and then talking about how all of that impacts the youth today and their own mental health. So I arrived at the topic because in around 2020 to 2021, our community really did start speaking more openly about mental health, and something that was kind of not talked about, heavily stigmatized, came to the forefront, and it was forced to the forefront because we were experiencing a lot of suicides in the community. It's specifically among young people between the ages of like 18 to 25. And so we were forced to have a conversation about it. And obviously it is my community, so it's something that's deeply personal to me. So I thought that this documentary would be a great way to talk about it, start discussion, share our story, and also just provide space for the generational healing that can come from talking about it and providing space for those conversations to happen.
Thank you. I mean, it was incredible too to see these clips. So I really appreciate you sharing them with our audience. I'm going to turn to you now, Blessed. I was really struck by your field note and one of your closing quotations from Amanada. She reacting to the recent protests about inflation. It reads, "They died for food to eat, they died for a place to live, and they died for nothing." And at that moment, I'm wondering, did you hold your reporting on mental health kind of apart from like other urgent needs from food and water, these really material, urgent things? And of course, you can talk too about how you arrived at your project, but that was what was most salient to me.
Yeah, so when I started my reporting project, the idea was to go and look at the first group of indigenously trained psychiatrists in that country, and to explore what their life was like, and to explore what the challenges were that they were facing. But I realized when I hit the ground that actually kind of wasn't the story. There was a lot around that story about the people that they were treating, and wanting to understand more about their lives and what their mental health journey looked like. And part of that realization came through being present during a nationwide protest that was, as you mentioned, generally about inflation, the cost of living in the country, and learning how all of that was influencing not just the patient's mental health, but also the ability of physicians to treat mental health in the country. And so I like your question. So my opinion on your question is, the answer is no. You really can't divorce your immediate physical needs, social needs, needs for food and water from mental health needs. It's one of the questions that I grappled with when I committed to telling the story about the protest, because on the surface, it may not seem entirely, relevant to my story on mental health, but there are larger implications of the sociopolitical environment on mental health and mental health care delivery. And in fact, one of the things that I mentioned in this particular story that I wrote is that, the medications are among some of the many resources that are becoming increasingly unaffordable for citizens in Sierra Leone. And I think one of the sobering revelations that came about from spending time at the psychiatric hospital is that a lot of the patients there do not or cannot pay for their own medications as a consequence of inflation and the rising cost of living. And that, of course, makes a huge difference in whether or not mental health care treatment is successful at all. So what I learned in my reporting is that, the families that can afford these basic necessities like food and water also are the families that happen to be able to afford transportation to the hospital. They're the families that can afford medications that their loved ones need. And as a result, unsurprisingly, the patients from these families do very well. And so you see that healing kind of becomes a privilege for those that can afford it. And so that's why when it comes to mental health, I think addressing the standard of living in the country is just as important as, the mental health care infrastructure that I was reporting on. And so that's why I felt it was important to report about that protest, to provide that additional context and background about some of the factors that are influencing mental health in Sierra Leone.
Yeah, that's fascinating. Thank you. Diana, I want to hear more about your project. And I was also interested specifically, in the importance of mental health and psychosocial support for refugee populations, and how governments are involved here.
Thank you, Ethan, and thank you to the Pulitzer Center for hosting us today. I'm so glad to be a part of this panel. So a little bit about my project, which was called Uncertain Futures, Ukrainian Refugees in Turkey, 1 year on at the time. That was in 2022. So it's been about 2 years since I conducted my reporting. What brought me to Turkey was the fact that it's it remains the largest refugee hosting country globally with over 4 million refugees. I'd spent some time in Turkey doing humanitarian work on the Syrian crisis. So felt very intimately connected to, the Turkish immigration system, understanding the humanitarian system operating within the country, and wanting to understand what implications this had for the Ukrainian crisis, which was so nearby. So I went to Turkey to speak to Ukrainians who were mainly in transit. So it was a few months after the Russian invasion of Ukraine. So I met a couple who were, for example, on vacation in Turkey when the Russian invasion began, and then found themselves stuck in Turkey. So hence the title of the report of Uncertain Futures. And with uncertainty came a lot of let's call it distress, and even manifestation of mental health symptoms and needs because of the uncertainty that they faced and their worry about what was happening back home, children that they left behind, grandchildren, as well as what it meant, what the Russian invasion and its and then the incumbent war meant for them as individuals now in Turkey with temporary status. It was a very interesting context at the time also. There was a huge rise in anti-immigrant sentiment as a result of the Syrian crisis, which remains. And it was in the aftermath of the COVID pandemic. So there was a lot of strain on the immigration system in Turkey. And it was very interesting for me to see how the Ukrainian response was handled in contrast to these other crises, and specifically this sort of displacement of refugees to another fellow Eastern country rather than, to the West, which is typically the narrative we see. So to answer your question, I mean, why mental health and psychosocial support? What does that term even really mean, and what does it encapture? It's a term used in the humanitarian space to define mainly programming and an approach to supporting the mental health of those in need, those affected by conflict, emergencies, displacement in this case. And mental health is more of the clinical term that applies to, I think, mental health needs and symptoms, as I meant, in the manifestation of conditions, and then psychosocial support to sort of aim to prevent these mental health conditions from arising. And so I think that this approach becomes really important when it comes to migration, because there are various entry points along the migration journey where these programs become essential. So in the pre-migration phase, after experiencing exposure to conflict, having to cope with the stress or distress of seeing loved ones lost, or experiencing armed conflict directly. And then in the migration and transit stage, which is what I was looking at in my reporting. So in a country of transit or on the road to your final destination. And then the stressors that also show up in country, and when you have to finally integrate and stay put. So there's a lot of there's a spectrum of mental health needs, let's call it, throughout, that I think require addressing from not only humanitarian organizations supporting these populations, but in these the countries that they're deciding to seek haven in. And that's why I like what Blessed had said about the standard of living in the country. This really applies to host countries as well, as how can you facilitate a standard of living that's that is adequate in order to support these individuals in integrating. And so there's a large responsibility on host country governments to prioritize the needs, mental health needs of refugees. Unfortunately, it doesn't always happen, and there are a lot of competing priorities and funding gaps. But part of my reporting was to advocate for initiatives like this.
Thank you. And Diana and Emma, my first open question is for your projects largely. I'm interested in how people, what home meant, HOME, to the people you spoke with in your reporting. How did their feelings regarding home affect their mental health? And what is their relationship, right, cross-generationally, to their host country and then to their origin country? What did that look like among the people you spoke with?
Yeah, I can go ahead and answer. And I think it's a very good question. I think home is something that I think about a lot, and obviously really pertains to my project. While reporting, I spoke with majority youth from South Sudan that live in America, and I also spoke to one social worker from South Sudan who had firsthand experienced the war, making the move here. And so obviously to her, home is South Sudan, and that all that she had to leave behind, where family remains, where she grew up. And I think for me and for the other youth that I spoke with, that also is home, but part of the mental health issues that we're facing is kind of grappling with that biculturalism of that's home, but because of the war, a lot of that home was kind of stripped from us, right? Like many of us haven't been able to visit. We still can't visit. Many of us have lost relationships with family or lost family. Many of us don't have that language anymore. So it really does complicate what home means. I would say that for the majority of the youth that I talk to, home would just be both. But again, it calls into question like what it means, what home means, what is necessary to be able to call something home, what kind of safety and security is necessary, what kind of community is necessary. So yeah, I would say both South Sudan and America, and it changes for each person, but it is a question that my documentary definitely grapples with.
Yeah, thank you, Ethan, for that question. I would add to that that it's such a relative term, and I think it's really time dependent. So given maybe when you're asking someone, you know, what is happening in your home, you know, how do you feel about leaving home, you know, that definition of home sort of changes, especially as you're seeing your home kind of you know, being changed by conflict or by actors you don't recognize and by violence. I think the interpretation of home really does center around where you feel safe and secure, but that you'll always have these memories of where home is and what it should be like. I think that's part of the struggle with for those who are displaced, and especially forcibly displaced, is that they don't have that closure of, you know, even taking material things with them to this new country, be it photo albums or, you know, their personal possessions, their education certificates, diplomas. They don't have a chance to have these things with them that allow them to then facilitate their integration into this new context. And so that concept of home is always I think longed for, and with the people I spoke to, at least the couple that I had mentioned got stuck in Turkey and then had to stay. They, you know, they were longing for a home that they recognized had already fundamentally been changed. And even in my recent check-in with them, I think they've started to establish more of a home in Turkey, having rented a place, gotten temporary protection, really kind of contending with the fact that the war is going on. And the same applies to other forcibly displaced populations I've spoken to. And the thing I wanted to add is I also spoke with children who were displaced from Ukraine. Actually, they were resettled in Turkey as orphans because some of them had parents who were lost in the war or who were fighting in the war. And for these children, it was actually very interesting because for them, home was the same. It hadn't changed. Maybe they had seen some, you know, negative aspects of the war before they left, but now they were in Turkey and they were being housed in a hotel. And for them, this was their new temporary home, and it was a lot of fun, and they were surrounded by their friends, but they were longing for, I think, the end. You know, they wanted to go back and be with their families. So their concept of home was unchanged. So it's very interesting also to think about the generational aspect here and how different generations cope with this turmoil.
And I want to remind folks to please start submitting your Q&A questions when they come to mind, and we'll address them right around 1:45, 1:50. My next question is for Blessed, but you are all welcome as you address it in all of your projects. And you know, we're talking some, and I know this has entered the popular consciousness a little more. But there's technology is kind of in many ways extended virtual, like a therapeutic intervention to more people than was possible even a decade ago. Are these viable options? And I know, Blessed, you take this as part of like a globalization of mental health. And specifically, I wanted to know in Sierra Leone how this technology has changed attitudes, whether that's social networking technologies or or therapy, virtual therapy. And how do you see personal computing and globalization generally changing the future of mental health care? That's a hard ask, I know, but we can start with you, Blessed, and then I'll open, everyone else can chime in.
Yeah, that's a great question. I'll take it a piece at a time. So, in response to your question, how is technology influencing mental health, changing the future of mental health? I think it is definitely making a huge difference in Sierra Leone. Right now in the mental healthcare space specifically, I know that last year they just started this their first ever mental health helpline, which is very similar to, in the US, we have the 988 number that you can call in case of mental health emergency. So it's something similar in Sierra Leone, where Sierra Leoneans can receive, free support, free referrals for any and all of their mental health needs, which is huge. Projects like this are super important in Sierra Leone because it enhances access to mental health in a country where there's really only one psychiatric hospital in this whole country for 8 million people, and it takes a whole day, sometimes days, to reach that psychiatric facility from one of the more remote regions in the country. So it's bringing mental health to the doorsteps of folks that really would have had to push themselves to receive even that basic level of support before, digital mental health became a thing. And that also directly, stifles stigma and negative attitudes around mental health, because suddenly mental health isn't this thing that you receive from thousands of miles away in some city you've never been to before, that you have to, make this huge journey to. It's actually right here at your doorstep. It's something that your neighbor and yourself is just a call away from. And then I think, to answer maybe the second part of your question about, the larger globalization of mental health, I think, in terms of the larger global stage, there's been some rumblings about digital technologies like AI entering into the mental health space, and there's lots of thoughts about that. And I think what I'll say is that, I think we're a long way from computer doctors, but I do think a lot of the tools that AI has to offer can be used to sort of supplement the expertise of mental health professionals. And more importantly, I think that, AI and other digital health tools can be used to kind of scale up interventions in places like Sierra Leone, where the ratio of providers to patients is really, really, really low, and leaves a huge care gap. So I think it's super exciting to be entering an era where, because of technology, people can take charge of their health in ways that really haven't been seen before. But I will say the one caveat to all of these new technologies is that the cultural humility piece. So when you ask if these technologies are viable, I think it depends on the cultural humility piece, because we can't forget the context in which these technologies were created, and we can't ignore the context in which the technologies are applied. So that would be my one worry, perhaps, about how digital tools can influence the future of mental health care.
Thank you. Yeah, and I'll invite now Jana and Emma, if you both have anything to add, I'd be interested to hear your perspectives.
I agree with Blessed. I think that digital health tools, especially pertaining to mental health, can solve a lot of the access gaps that we see. And in thinking about, for example, forcibly displaced populations who are in a country where they don't speak the local language or don't know how to navigate the local health system, these kinds of resources become all the more imperative. But I think that there remain many barriers to, I think, integrating these kinds of tools more readily, especially we can just start with digital literacy. So I think even the couple I interviewed were a little bit older, like maybe less inclined to use apps, and there are tons of apps developed for refugee populations, not only in navigating, local systems, legal systems, health systems, but also even like mindfulness apps, meditation, like things that have been culturally adapted and are available in their language. But we see very low utility or utilization of these resources for a combination of reasons, I think, including digital literacy, but then also maybe lack of awareness of that, these are mental health needs and that they need sustained and required treatment. So that by the time that they're recognized, they're often quite severe. And that's why we see these populations accessing care at a more advanced, level, like outpatient or inpatient care, because their needs have manifested over time. So yes, ideally having these types of tools, especially for younger populations, to prevent mental health conditions from worsening would be ideal, but keeping in mind some of the limitations that Blessed alluded to.
And Blessed, I think your point too about humility is important, and I think this leads to my next question, which is what are some patterns that you've noticed for all of you in your reporting about the way we talk about mental health? Have you noticed, or that you think our audience should know? Have you noticed, say, the use of the collective more often, or is it more individualistic elsewhere? And what's general cultural awareness and all of this, right, plays into dominant like largely executions of like virtual mental health care, where the language is one way and people interpret it another. I wondered what that experience was like for all of you in interviewing. Would you mind, Emma, if we started with you?
Yeah, sure. When I was discussing mental health, I think in my community, I had to kind of tailor my language, depending on who I was speaking with and, what I was trying to convey, just to make it accessible, obviously, and to try to battle that stigma that we're facing. So I think one thing that I can say that our culture kind of views as mental health that is a little different than how maybe my community views mental health would be the kind of individualistic aspect to it. I think a lot of times when we speak up about mental health, it's a lot about self-care or like, what can I do to feel better? And it's a little separate from like the context of everything that can be affecting your mental health. And that is kind of goes to what Blessed was sharing about and what all of us kind of talk about in our projects, which is how safety and security and mental health cannot be separate. So it really is, when you talk about mental health, it is a conversation about what kind of resources do you have? Do you feel safe? Do you have food? Do you have water? Do you have shelter? Because without those things, your mental health is not going to be great. And even if you have and if your mental health is great, but you lose those things, then the opposite effect could happen as well. So they really are tied together. And then I think the second part of like how I talked to my community about mental health was really just trying to focus on the feelings that people were having, and not even just emotional feelings, because I think that's also hard to talk about depending on your upbringing and that generational trauma as well. But like physically, how do you feel about things? Like even speaking with youth, I tried to not ask like, oh, did this make you feel depressed? But it was more like, who do you talk to? Or if you don't talk to people, like, why do you think that is? Where did that come from? And just trying to just use less technical terms was even helpful in discussing language and thinking of it more as like a communal wellness and less individualistic, which is kind of opposite of how even I learned mental health like in this country.
To add to what Emma was saying, I definitely took more of that approach where more of a humble approach where I didn't impose, any kind of any of my thoughts or what, I expect this population to be experiencing. I learned that a long time ago with my work with Syrian and Arabic speaking communities, and being Arab myself, like really understanding how mental health is conceptualized in that culture. So with the Ukrainian individuals that I interviewed, I took a similar approach, like not wanting to impose my, Western constructs of mental health, and really letting them articulate what they were feeling. And it was very much starting with that, how are you doing since were displaced from your home? What's the situation back home? How are you keeping tabs on your family and loved ones? How are you feeling here in Turkey? Is the government supporting you? What resources do you need? And then naturally they start to share, I think, maybe where they're experiencing some distress, and then that could even really show itself in terms of like emotionally responding. Like I remember the person I interviewed crying, really thinking about her home and how much she was missing her family, and wanting the war to end. And then just having, I think, the resources and the sensitivity as a reporter is really critical. So I always have a list of mental health resources that are local. For example, at that point, NGOs in Turkey working with Ukrainian populations that I had on hand to offer. And I always want to make sure that it's, not something imposed on the individual, but since I saw that she was upset at the end of the interview, the formal process, I told her, if you need any support, there are these Ukrainian NGOs working here to support folks like yourself, and that it's totally optional. But just having resources on hand, I think, is also really important. And I'm hinting at one of the questions that came up in the Q&A, but what I think a responsibility as reporters to and researchers in many regards to make sure you're approaching this issue with sensitivity.
Yeah, I was just gonna say, both Diana and Emma answered that question so beautifully, and in a way that I think, as you were saying, Diana, answers one of the questions in the chat already about, how do we ensure that we're giving the topics that we report on the appropriate sensitivity that they deserve. And that language is such a big part of that. It's such a big part of that. And what I'm hearing from the other panelists about this is, how they were able to be intentional about their language in a way that provoked trust building, and also empathy, and also sensitivity, that helped make their reporting a lot richer and a lot more accurate, which I think is always the goal. I think also, in addition to speaking to the language of the subjects that you're reporting on and about, I think for me, I also had to take into account the language of the medical professionals that I was talking with and interviewing and working with. So I think that, for me, it was interesting because there are so many classifications that we use in the US for different mental health disorders that don't quite translate in the Sierra Leonean setting. So, for example, what a provider in the US might describe as depression, civilians and even some professionals in Sierra Leone might refer to that as pualat, which literally translates to spoiled heart. And I think that this language kind of denotes a certain kind of cultural subjectivity to mental illness that's important to be aware of when you're reporting in these contexts. Because it's not like you're going to be able to find, the term pualat in the DSM, which is our diagnostic manual for disorders that we use in the US. And there's no like one-to-one perfect comparison of symptoms between depression and pualat, because, the very ways that we express and communicate psychological distress are just different. And that, I think, is just really important when you're trying to compare mental health systems or make evaluations about the quality of treatments in one setting versus another, which we often do in global health reporting. So I just wanted to add that piece in as well.
Well, thank you all. Before I open it up to our Q&A questions, I just have one more, which is, did you ever worry, and if you did, how did you deal with it, about re-traumatization during your interviews? Because these can take on really a lot of charge. Do any of you have something to share on that?
Yeah, I can share. I definitely did. And I think as a journalist, we all should to some degree, like we should be worried about taking care of the people we're speaking to. So the way that I kind of navigated that and mitigated that was in just my approach. Obviously, being from the community helped because I was able to offer a level of like self-disclosure to make our conversations actually conversational and not just like an interview or feel as extractive. Like talking through things slowly with like at the pace of who I was speaking with. If experiences came up or stories came up, like definitely following their lead, not asking as many follow-up questions as maybe I want to, or bringing it up later, or just making it very clear that I only want to know as much as they want to share with me. So I do think when speaking about war and mental health and just these really sensitive topics, like it is more about caring for the individual that you're speaking with over the story that you're writing or sound bites that you want to get for your documentary, right? So yeah, it's just I was able to just like be a little more careful and intentional, and provide space for breaks and things like that to try to avoid that re-traumatization, because it's obviously very easy to happen when you're talking about things like this.
Jumping in here, I think what Emma said is spot on, and why I think it's almost critical for reporters, no matter what background they come from, to have at least some understanding of what distress can look like. Obviously, we're saying that it looks different across populations, but to at least recognize when somebody is feeling uncomfortable or is potentially becoming re-traumatized by narrating their story, and to know when to stop and take breaks, and certainly make sure that that person consents to continue. My broad approach was very much like the consent process. So before even starting the interview or touching base with this person, making sure that because I was working through a translator, that my intentions were well communicated. Why am I doing this project? What's my background? What's the goal and aim of this work? It's not going to provide any catch-all solutions. It's also not going to be reported to the host country government. It's just a way to shed light on the situation and the plight of these people. And I think my interview subjects like really appreciated that transparency and felt a lot more at ease after hearing my background and why I was in Turkey doing this work. And then in the aftermath of the study too, or excuse me, I speak like a researcher, after the report, I shared the story with them before it went out and was published, and they expressed their feedback and also their appreciation for the way the story was told in a manner that was very sensitive. And so maybe this is a place to advocate actually for reporters who are working specifically on mental health or conflict affected populations to put it on themselves to be more wary and sensitive to what mental health needs look like, and how distress can emerge as a result of interviews, and how to handle it, like having resources on hand, like I mentioned earlier.
Thank you. I think we're going to start taking audience questions now. Blessed, I'm going to turn to you first. We have a question from the audience. How do we decolonize mental health, and how much of a need is there for developing mental health approaches that are not rooted only in Western concepts and views?
That is a really great question, and the need is really, really high. I think I want to speak to this question from the perspective of, my reporting. I think one of the ways we decolonize mental health is decolonizing global health journalism in general. I think there is this, especially, I think this became even more obvious during COVID, when a lot of journalists couldn't travel. And so you had to rely on the reporting and information coming out of journalists that reside in the countries that were of interest. And I feel like that particular model of global health journalism can sometimes get lost, where we have a lot of these stories being reported by folks that have to travel thousands of miles to these places instead of journalists that, you know, are on the ground and actually live in the communities and experience some of the things that are being reported about. And so I think part one of my answer to that question is that we also have to, if we're going to decolonize mental health, we have to empower local global health journalists to be able to report in the topics that affect them and the communities that they live in. Because I also think that they have a lot of what we've been talking about is like language and, you know, how do we use sensitive language? A lot of those barriers, those language and cultural barriers, I think can be answered for by simply empowering local journalists to report on the stories in their own countries. I think also, you know, an addendum to that answer is that we have this hierarchy. I come from the world of medicine, and we have this hierarchy in medicine and in research that I really think we need to divest from, you know, and the hierarchy is in how we think about research and how we think about reporting. When we prioritize randomized controlled trials over qualitative studies, when the numbers are more important than people's experiences. I think that is a very dangerous way to look at research, and I think it's a way it creates a lot of issues in how we understand mental health in different spaces, but also how we prioritize our mental health concerns. Because those diseases and those disorders that don't have the correct resources to be able to, you know, become or be explored through randomized controlled trials are those that are ignored, and they typically come from the global South. So I think we have this issue, one, with you know, global health reporting in general, with, you know, supporting local journalists and being able to talk about these ideas in language that makes sense in the context. And then I think we also have an issue globally with how we think about research, how we create hierarchies in medical research and mental health research. And we have to move away from that, I think, if we're going to even begin to have a conversation about, you know, how we are decolonizing mental health.
Thank you, Blessed. That was excellent. We have a couple methodology questions as well. And Diana, I may turn to you for these. What advice do you have for somebody parachuting into a country to report on mental health? And how do you ensure you're giving that topic the sensitivity it needs and build trust with sources with limited time? And then there's also a related question, at least in my mind, about filming and recording audio, approaching subjects, you know, with equipment. And what do those conversations look like, you know, about the journalism process, especially if perhaps they're not familiar with, you know, with how journalists report and the timeline and such.
Thank you so much for that question. I mean, the idea of parachuting into a country is something that I think took with me and took very seriously when I embarked on this project, especially given that I could only spend a few weeks' time in Turkey. And so in order to, you know, check all my boxes and make sure I was approaching this sensitively, I started at the very top, you know, working with Turkish migration professionals and researchers and humanitarian workers that I had developed contacts with in my previous years in Turkey, and you know, really asking them, you know, what their perception of the situation was, where were needs most concentrated, did they have any contacts that they could put me in touch with, where I could, you know, glean sort of the lessons learned about what's happening with this given situation, and then make sure that I'm providing, you know, recommendations that align very much with the work that they can do to make the situation better. So I think really starting for me was what was important was working with locals, and in this case Turks, who were working on the migration situation and knew where the priorities were, so that I wasn't, parachuting in, so to say, and meeting Ukrainians and asking them to speak about their situation without having like a sensitive approach or a way of identifying those who would be willing to speak out. And so from there, that was when I realized that there were many Ukrainians that were in the coast, so the Mediterranean coast. That's where a lot of Eastern European populations actually travel when they visit Turkey. And so the couple I met, actually, like I mentioned, were on their summer vacation or their winter vacation when the invasion started. And I met them through somebody who was plugged into the kind of Turkish humanitarian response. And so before I think this like topic of sensitivity, before I even, began the interviews and embarked on this project, I made sure that I was talking to the right people so that I wouldn't, potentially traumatize someone who, was in a very vulnerable state, and was making sure I was speaking to somebody who was willing. Again, this is all related, I think, to my timeline, which was quite short. And I think just to reiterate the importance of, transparency about what you're trying to do and the expectations that are being set, that you aren't trying to provide a catch-all solution, but you're just trying to shed light on the needs of this population at this given time. And yeah, I think by being so open and honest, there was this kind of accelerated trust building and just mutual respect for what was taking place. But can that be replicated in every context? Can it be done sensitively with children? Certainly not. That's why actually for my study, for my reporting, I didn't interact with the children that much directly. It was more through the people who were working with them, the adults who were volunteering and supporting children, because certainly didn't want to expose an already vulnerable population to more vulnerability just for the sake of my story. Yeah, I hope that was a good response. It's hard to answer such a question and to do this the right way.
Yeah, I would definitely echo what you were saying. I think building that trust and just that sensitivity and being very honest upfront about what this project is about, what are the goals, where will it go, is very important with any kind of project, and especially when it comes to filming and recording audio, where you can't maybe change a name or, do things like that. I think as a journalist, it does become our responsibility to become creative if, there's boundaries put in place about not wanting to be filmed or not wanting you to film in specific areas. Like maybe you can film from behind where there's shadows, or maybe you can use pictures instead of going into somebody's home. So I do think that becomes a way for us to be creative and look for other resources as a journalist to be able to obviously respect people's boundaries and tell their story the way that they would like it to be shared, because this is just a tool to like raise awareness, and not, our goal is never to re-traumatize or do things like that. So yeah, I think when it comes to recording and filming, like trying to think of other ways to get the same visuals or points across that still adhere to, their boundaries is what is most important.
Yeah, thank you both. That was great. I think we're going to address a couple more questions here before we close out. The first is about, or it's for all of the panelists, and it's about brute societal structures like caste or race, which contribute to the discourse of mental health, and how this person asked, how do journalists keep themselves aware of such structures while reporting on the issues of mental health?
It's funny, I was also in Sierra Leone for very limited time. Like Dana, my reporting took place over the course of just a couple of weeks. So it was hard for me to really delve into some of the deeper racial societal dynamics, but I can kind of speak from a US perspective on that, because I do think we do have racial castes and structures that create differential outcomes for different sociodemographic groups. You have a lot of, for example, you know, in my field of psychiatry, there's been a lot of research done on, you know, what type of treatments are offered to different patients that are in different racial categories. So a lot of times you have Black patients or patients of color that are being offered resources or treatments for things like opioid use disorder that are I don't know how to, they're not less effective, but they're less convenient, and they're less likely to promote compliance with care, versus, you know, you have white patients being offered easier alternatives or more accessible alternatives to care. And that obviously is going to affect treatment outcomes. I think that, you know, when it comes to how journalists can address that, I think it's really important to understand the context behind the facts that you're reporting, right? So as a journalist, you can very well report that opioid use disorder treatments are differential between Black and white patients. But if you're not explaining the context behind the numbers, then you're contributing to the stigma, and you're contributing to a larger societal ignorance about what influences these mental health issues. So I think that one thing that I always try to do, and one thing that I think is just standard and good practice, is always explaining the numbers, explaining the context behind the numbers or whatever facts that you're reporting. Really important context to promote equity and just understanding of the overall issues that you're trying to report about.
Thank you. And just one more question, I guess, about where you all are going next with your projects, if you intend to go to take them farther. Do you have plans to research long term about the effects of war on children's mental health as they move into teen or adult years? And then do any of you see overlaps between living in war-torn countries and living in American cities with violent crime? And this is from an audience member.
I'll jump in on future plans. So I've committed my career to this space of really looking at the impact of displacement and conflict on mental health of refugees and migrants. And the focus on high-income contexts really comes from I think my personal perspective as a first-generation Arab American, understanding where there might be disparities even in a high-income country like the US, where services are available. You know, maybe they're costly, but maybe there are solutions around that. But people, especially coming from different cultures or backgrounds where mental health isn't that isn't easily talked about, even in the US for that matter. I think there still remain a lot of access and gaps with regards to barriers to accessing mental health care in these contexts. So trying to mitigate these gaps, understanding what the needs are, how to raise awareness, I think is critical, and something I've dedicated doing research on regarding barriers to care. And with regards to Turkey and the Ukrainian population there, it's fluctuated a lot since I did my reporting, but that doesn't mean the needs have dissipated. I think with populations around the world where you see long-term conflicts and people now you know, displaced to contexts where they think they've had to come to terms with, they have to integrate. This brings along a whole new set of mental health challenges that I think are more readily addressed by local governments in terms of facilitating their broader integration, giving them access to work, making sure that they are financially secure, helping them integrate their children into local education systems in order to alleviate some of the distress that, you know, that may have resolved from their migration journey, but then not forgetting that there might be some, you know, remaining needs that need to be addressed with adaptation of mental health care, dissemination of information about mental health care in the local language. So I mean, the gaps are plenty, and so I think that's a really important space to continue to work on, study, report on, and shed light on. You know, despite some of the sensitivities we addressed, I think that it's critical to just to make sure that these needs are known and to continue to advocate for greater awareness. I know we're short on time, so make sure my other panel.
I can jump in quickly also about future plans. So at the end of, my documentary, it discusses my interviewees discuss what they've been able to do in their own neighborhoods and organizations they've been able to start that specifically help South Sudanese youth younger than them. And so, elementary schoolers with after school programs and just opportunities to be in community. And so I definitely have interest in continuing to follow that and see how, after perspectives and beliefs and attitudes and stigma about mental health in our community, as that changes, like how are the younger people in our community beginning to view their own mental health, and how are they able to heal, and what methods of generational healing are being passed down from, my generation and the people above us and things like that. So I do think it definitely is a long-term story for me. And it's really nice to see that work is already being done with the people that I spoke with in the documentary.
Yeah, similar to Emma and Diana, I also have plans to continue the work that I started through this story. And like both of them, this story is also very near and dear to my heart, as someone that is from Sierra Leone, and then also very interested or becoming a future psychiatrist in the next couple of months. I think that, this story is something that has the potential to create a lot of important connections between the mental health care system in Sierra Leone and the mental health care system here. And that's something that I'm working on behind the scenes, kind of figuring out the logistics of. But in the meanwhile, I think, another important thing to mention in terms of where the story is going is it's partially up to you guys in the audience as well. I feel like our stories have been put out there. I think for me, myself, I put my story out there also as a way of creating collaborators, people that are passionate about, this work and feel strongly about any of the topics that we've talked about. I'm very open to being to connecting with anybody that, wants to take any of this project a step further, or wants to add a new perspective. Definitely, I don't know how I can provide contact information, but somehow maybe Ethan.
They can email outreach@pulitzercenter.org. It's on our site, and I'm happy to connect.
Thank you.
And that email will also be in the follow-up email that we send to everybody. Well, sorry for interrupting. I don't, Blessed, did you want to finish on anything, or were you done?
No, I think that was it for me.
Well, awesome. Thank you all for attending. I have a couple of closing slides here, so bear with me. Like I said, thanks for coming today. We really appreciate you for joining us. And for those who are able, consider becoming a Pulitzer Center champion to support our work. It really helps us do powerful events like these, and also supports our incredible journalism, professional journalism, as well as our student journalists. So finally, a survey will follow the end of this webinar. A link will pop up in the post attendee tab that Zoom will generate. So thank you in advance for filling that out. It really helps us out. And thank you again for joining us. I hope to see all of you again. Bye for now.
Thank you. Bye.